room, and we're going to get into one crippling conversation this hour, because the question is, when you ask yourself, when you're by yourself, what on earth is going on? And perhaps that's what we will do at this point. In as many years as there have been since 2024, this would be the third strike, Correct. Of this one sector. There's one that has been ongoing. Community health providers have been on strike for I don't even know how long. The clinical officers have then been on strike. They've gone on strike, they've pulled it back, they've gone on strike, they've pulled it back. This is the third one that we've seen in a very short period of time. And as they've been on this strike, the thing has been that they came out very clearly yesterday and they said, it doesn't matter what you do. Unless the thing that you do is what we agreed on, we are staying on strike. They said, come rain, come sunshine, unless you adhere to the terms of the collective bargaining agreement, guess what? We're going to continue being on strike. We feel for the people who go to hospital and need to be treated and they cannot. But if we don't do this thing now, we're never going to get a resolve or resolution to this problem. Now, the Kenya Environmental Health and Public Health Practitioners Union has joined this strike, or rather has co-joined in this, and they've said for a reason, this is why. Now, Brown Ashira Olaly is the National Secretary General and CEO of this union and joins us in the Situation Room this morning. Good morning, Brown.
Good morning to you.
Karibu sana.
Thank you.
Thank you for being here. Let's get into it and find out what exactly is happening and if the needle has moved. But before we do that, Dennis is going to welcome you with today's proverb.
Yes. Okay. Today's proverb comes from Mali. So you think of Mali, and there's a phrase that men usually use. I will go to Timbuktu and back. Now, Timbuktu is actually in Mali, and it is one of the centers of Islamic knowledge in the continent. And you think about Mansa Musa, and the richest man in the world, pretty much, because of the gold deposits that Mali does have. The proverb that you get from Mali today: a fly perched on the scrotum is gently nudged off, never struck. How would you interpret it?
Come again?
A fly perched on the scrotum is gently nudged off, never struck.
Okay.
Brown's trying to figure out how the fly got there the first time.
I'm trying to imagine how the fly get to the scrotum anyway.
Just chilling by the beach anyway.
A flight? Come again?
A fly perched on the scrotum is gently nudged off, never struck.
Okay. A fly perched on the scrotum
is gently nudged off.
It's gently nudged off, huh? That is, it's a bit challenging.
Don't overthink it. Make it as easy as possible.
Okay, forget this. Okay,
Okay.
What? A mosquito on the wall is not hit using a hammer.
A hammer, you cannot hit hammer. You don't need to use a lot of energy.
Exactly. See?
To be able to do a simple thing. Yes.
See?
You make it simple and do the right thing.
Yes.
Yeah.
Okay. Some could argue that you would make it simple and just follow the requirements or the standards of a collective bargaining agreement.
Exactly.
Make it simple and people can go back to work and the people who are sick can be treated.
Exactly.
Is it that simple?
And really, that is the reason why we're actually not getting it right as a country, because precisely simple things don't appear simple to everybody. Particularly when you actually enter into an agreement with somebody. They're actually not taken very seriously. So, and that's the reason why we have been having these perennial strikes, and the reason why the health sector is the way it is right now, because we have people who don't take it very seriously. They take it. They don't actually be able to. Don't take it very seriously to the effect that they don't actually be able to actually appreciate it. So we need to reach to a level that we need to agree that this is actually not working at the counties. We need to have it at the national government. Because really, we cannot be having same issues year in, year out, talking about issues that our government of the day cannot be able to implement. One, for example, the main issue why we're actually having a paralysis in the health sector in this country, and it's quite unfortunate because it is the patient actually bearing the bare knuckle. we have had universal health coverage colleagues who have been working for over 6 years.
Right.
On contract. The contract, these people are the people actually brought on board to be able to help us realize the universal health coverage dream and also help us fight COVID-19. The government actually got a contract for 3 years for them. When the contract actually elapsed, they actually renewed it for another further 2 years. Then they actually renewed it. So they have actually been on contract for over 6+ years, which is actually against the Labour Relations Act, against the Employment Act. These people are actually exposed to the same work environment together with the other colleagues who are actually on permanent and pensionable terms, receiving lesser or meager salaries compared to our colleagues who are actually on PNP. Remember, when you're on a contract, there are things actually you don't receive. First of all, there's something we call security of tenure. You don't enjoy security of tenure. You're not even eligible to even get a promotion. You're not eligible to even get a loan from any loan lending companies. So these people have actually endured that hardship. And this conversation has been there for a long time. And that has reached a level that as unions we said, no, we can't agree going forward. We need to make sure that we actually bury this issue once and for all. And that's the reason why we actually lobbied for monies. We went as a union to lobbied for monies, actually ensured that the Ministry of Health appropriate monies and actually monies were actually approved by the Parliament now to be able to convert these colleagues to PNP terms so that we can be able to heal or rather cure the illegality.
Has that happened?
That one happened. We have the money. But now the problem is there's actually the two levels of government are actually trading blame games. There's a push and pull in between the two. None of them want to take responsibility. I want to give credit to Honorable Duale. Actually, when he came in the ministry, there was an issue about the UHC. He tried. Right now, at the payroll of the UHC, they actually changed the ROD terms from now contract to PNP terms. But now the problem, the ROD on the payroll.
For whom?
For the UHC.
So the ones who've been on strike, who've been in contract for 6 years,
yes,
are now saying that it's now?
Changed now on payroll from contract to PNP.
Yeah. Okay.
Now, the problem comes here, and when you're actually changing on a payroll and you don't have the letter to show that, it is actually the appointment letter that actually defines the terms and conditions of engagement.
So who appointed them to PNP?
They were actually appointed by the counties.
The
ministry advertised positions. And because health is a devolved function, those officers were actually interviewed at their respective
to help
counties.
Brown, to help contextualize the information coming out to the streets.
Yes,
protesting could be doctors, could be clinical officers, it could be nurses.
Or public health.
Yes. And could be the private hospitals demanding payment that are long overdue.
Yes.
And the issue narrows down to one thing: resources, money.
Correct.
You don't complain about anything else. You don't complain about regulation. You complain about remuneration. Now, as we understand it as Kenyans, health is a devolved function. So the CES and the national government should have very little, just within policy level, to do with the health management of our country, the health system. So if health is a devolved function, and today you're saying you'd wish to have a reversal of the constitution, where it goes back to the national government, whom do we blame? Is it the people, the governors? Because from what you're saying, you're even appreciating, the front page of the Daily Nation is talking about 1.2 billion being lost, courtesy of the same CS Health you're saying you're grateful for. Perhaps he's done some good things that we have not seen or heard
of. The UHC.
Fine.
Particularly on the UHC.
So, whom does the buck stop with when it comes to management of our health system in this country called Kenya?
First of all, our constitution envisages a two-tier management of healthcare in this country. The national government has a responsibility on the national referral hospitals and also on the regulation, plus setting standards.
How is that going according to you?
For let me just contextualize a bit.
Okay.
Then the counties have also their bit on the issue of to do with human resource management and also the facilities that those county facilities, the level 1 and 2 facilities. That's the hub and spoke. The level 1 and 2 facilities. The counties have a responsibility to be able to conduct the primary healthcare facilities and be able to do that. The national has got its own bit. Now, this is a situation where we, every day the national government actually gives money to counties by the way of the constitution. There's that shareable revenue,
yes,
that the counties are supposed to get monies from the national government to be able to do their activities, because resources must follow functions in that context.
Correct.
So if we are seeing our governors not doing their bit, there's no money for anybody here. Monies follow budgets. Budget. Like for example, right now we have a fiscal. There's a budget process.
Yeah.
Everybody is expected to give the estimates to the national, to whoever, and ensure that these estimates, this budget, actually is funded by the national government or the county government. What we are seeing is a situation of supremacy battles between the two levels of government, and that's why we are saying the same way we have education and security domiciled at the national government, you don't see problems with them. We also want health to be domiciled at the national government so that we can be able to have an easy ride, a smooth ride in the implementation of healthcare services. Remember, Article 431 talks about the right to healthcare, and it actually singles out all the services, be it curative, be it preventive, be it palliative care, all the healthcare services being the right as a right of Kenyans. When we deny them, cases of us going on a strike because of an issue that is actually very simple. Like when you sign a CBA, for example, then we sit.
So who signed the CBA?
The CBA
with the
is signed by between the employer and the union.
And the employer is the county.
In this aspect, the employers, we have two. We have 48 not governments.
Yes.
The 47 plus the national one,
government,
where now all of them sit together at a central place and then sign a CBA. So therefore, it is their prerogative to be able to implement the CBA.
So before you take the industrial action,
yes.
Before you take the industrial action of going to the streets,
yes, sir.
And well, rightly so, because you are fighting for your rights, but patients will be abandoned in one way or the other.
Correct.
Have you sought audience with the 48 organs of employment?
The Labour Relations Act is very clear.
Yes.
There's a procedure to issue a strike or even a lockout. If you have to go on a strike as an employee or as a worker, you give, first of all, a demand notice.
Which
we did.
Okay.
We gave a 21 days demand notice. Later on, the demand notice was not honored. We later came and gave now a 14 days strike notice, highlighting the issues that I'm actually discussing them here. The same 14 days elapsed. The national government, the county, did not invite us for a meeting. For example, and in our notices, we've always said, we remain available for amicable resolution. The employer has not invited the trade union, the other union need us in a meeting. How do we expect us to speak? We don't speak with the walls or tables. We expect that, being a serious government, they will actually see the sense of inviting the union leaders for a meeting, broker a truce or rather broker stalemate because of the issues. Let the Minister of Labour is silent. The Minister of Health is silent. The Council of Governors are trading blame games to each other. Where do we actually go? And here we are saying these issues need to be sorted. Now, we cannot be able to talk when we have not been invited on a table. We are saying even right now, even if they were to call us even right now, we are willing to go and sit down, agree on the issue, and not just agreeing. We need to agree and have an implementation of framework on what we're actually agreeing. Remember, doctors went on a strike on a 2017 CBA. That was actually signed and not implemented. We have a tendency in this country, we have a tendency in this country of signing documents, then we don't implement them.
And Brown, that then brings me to my question where you have sat before with all these centers of employment.
Yes.
Right? National and county governments. You have signed CBAs. They've not been honored. You've just confirmed here that the cabinet secretary changed on the payroll the payment status from contract to PNP, right?
Yes.
While at that then, from where I sit, if the contract does not give that right to be paid, that is an illegality, because
Yes,
you're
sir.
paying using what document, you know? Because at the end of the day, it is the contract that you've been given to confirm that you are PNP that then gives the right for one to be paid on permanent and pensionable terms. From that right there, that is an illegality that you as a union as well should be highlighting. But that notwithstanding, I want to look further beyond that, where we equally look at understaffing within your union, within your framework. And that has affected in terms of going to schools, going to hotels, to do your research, to look at how all these public utilities, if they are fit for occupancy, you know, but that is not happening as we speak. So how dire is the situation? And is there any room for negotiation with the government or these centers of power? And if not, then what's next for Kenyans?
I'll begin with the part A of your issue about the change of ROD from a contract to PNP. I'll say, to me, that was a stopgap measure. Really, remember, these people were not paid. They were actually walikuwa wamefanya kazi. They actually worked for the whole July without a pay, and therefore they were also actually continuing to work. You know, remember, there's this trading of blame games, and therefore remember the PS for Medical Services issued a circular to the State Department of Public Service and Human Capital Development to request to revert back, because remember, the national government had transferred, or rather migrated, the payroll from the national to the counties for purposes of ensuring that we have a smooth flow of transition from PNP, from contract to PNP. But that did not happen. So when the government or the national government or the Minister of Health saw that, and we were to avoid crisis, because these people need to be paid at the end of the day, they are actually working. They requested for the payroll to be reverted back to the national government so that they can be able to facilitate the payment. That's what I'm saying. That's why we actually giving credit to the CS, because actually, why not? Because of that, then we also be in a very dire situation.
But it's still an illegality nonetheless, though.
Be it as it may.
No,
that's what we are
it's still
saying.
an illegality.
You cannot call upon the law
Yes.
To protect you while
an
breaking it at the
yes.
same time.
Well, who is the employer of these people? Who is paying them? Is the Minister of Health.
but they
It's
committed.
the Minister of Health. These people are actually seconded in short, because of course the person who pays you is actually literally your employer, because I've owned your payroll. But the fact that these people are actually working at the counties, the person paying me, the actually is not those counties.
But let me ask you
have
differently.
a primary responsibility.
Let me ask this in a different way.
Yes.
Let me ask in a different way.
Yes.
Any Kenyan today would go to court
Correct.
to ask that funds that have been paid to your members without legal documents, without a legal contract, be paid back. That's a reality. And that as it may, then you as the union, knowing very well that your members are being paid outside the law because they do not have contracts that give them the right to be paid that money. What is the ministry and all these centers saying with regard to that? Because you're staring at a matter in court.
You see, two wrongs don't make a right.
Thank you.
When there's a problem, you identify there's a problem, as a leader, you have to solve the part A of the problem, which is, and I remember I began by talking about a stopgap measure. I'm not saying this is the real issue, and that's why we are still on strike, demanding that this issue about PNP be resolved. By the way, we don't care who gives them, whether it's the county or the national, so long as these people are issued the PNP letters, that's all we are actually asking for. So the Minister of Health, as it is now, are actually the legal employees of these people, because they're the ones actually.
So it's not the county. It is not the county.
The
It is
county
the
is there
ministry.
for the service, but the payment emanates from the Minister of
So
Health.
today,
Yes.
is the contextual issue just the contract, or are there any dues you are demanding?
We're actually demanding even service gratuity.
Which is,
Because,
in your estimation, how much is that?
that is calculated to that 1% of the basic salary.
And all of these were in the CBA.
Yeah, no, the
Because what we understand is that they've strayed far from the CBA, and that is one of the bones of contention. But these things that are being requested or required or demanded that have led to the downing of tools seem to be outside of the CBA, or is it things that were picked up along the way?
we're talking about gratuity. We're talking about the contract they signed, the individual contract, because when you're actually signing a 3 or 6 years contract, it's actually stipulated that you'll be entitled to that 1% of the gratuity.
Okay.
So we are not yet there at the CBA. The CBA is a whole different issue because we're actually still talking about the contract that these people actually have.
Okay.
They have actually served.
Okay.
So they're actually entitled to that 1% gratuity.
Okay.
Yes.
Now that's clear. But the issue here is that every time there's a strike notice, and then going into the strike itself, that the CBA is referenced as having not honored the requirements or the stipulations within the CBA. But it is the same Ministry of Health, it's the same county governments that are being called on. Gibore was very clear yesterday and said they fault the county governments for having not followed certain things. And that the CBA is now the Bible or the document that's being followed.
That's true.
But it seems very clear at some point that these folks are not playing ball. But it's like we're stepping on the pedal and we're saying, okay, let's go on strike. We'll be on strike. Then somebody needs to just come and whisper in your ear, and then you say, okay, fine, let's go back to work. That if this thing was so serious that it wouldn't matter what was said, folks wouldn't go back to work. Because the reality of the day, let me tell you what the reality is. Today, as we're looking at this thing, paralyzed operations, inpatient admissions. Somebody is sick, they need to be admitted. It's not going to happen. Routine clinics, we're talking about prenatal, we're talking about people who are going for what's this thing, kidney dialysis. We're talking about people who are going to get checkups on oncology. All of those routine clinics will not happen. Emergency care has been severely disrupted across public health facilities, and this is countrywide. Patients are forced to seek costly alternatives in private hospitals or face long delays. One doctor was already seeing thousands of patients. That number has easily doubled in the last couple of days. Referral escalation. Top referral institutions, everybody was flocking to Kenyatta National Hospital before, so you can imagine what's happening today. Now, I'm not faulting medical workers because absolutely people's rights then should be adhered to. But we're spiraling into a situation that is going to become ungovernable and unmanageable in 24 hours. And it seems as though we never take it seriously enough because somebody is going to come and whisper, and as soon as you say Bob's your uncle, folks are going to go back to work. So and it's going to sound crazy, but if you had put the foot down the first time you went on strike and said, let's fix this thing so that we can actually offer the maximum care. But then we go back and we give people the illusion that all you need is a whisper and a prayer and everything will be okay. Nobody's serious here. Whether it's the ministry, whether it's the counties, whether it's the striking workers.
I'll say this. Thank you for that analogy. Thank you for making it clear. A CBA, for example, a collective bargaining, it's a document that has a myriad of issues agreed upon. That's what's called a collective bargaining agreement. We bargain. The two parties sit down. A part of the issue that actually entail the CBA, the issues to do with the allowances, for example. I can talk about, for example, call allowance. For example, clinical officers are actually talking about enhanced call allowance. Also, public health officers are talking about issues to do with the allowances, promotions, employments. So if we sit down, for example, with an employer, agree, for example, that, for example, by this date, we need to have actually given specialist clinician or specialist public health officers a special allowance, and then you negate as an employer to be able to adhere to that, then to me, I don't know who's supposed to be blamed in this case.
Okay, let me ask you. Let me ask this way.
Yes.
So there's a CBA in place. When is a CBA being agreed upon? Who's in the room? Both sides,
Both
right?
Parties, yes,
Both parties are in the room. In this case, the Ministry of Health and the representation of medical workers, right?
Correct.
Now, in this case, we're talking about clinical officers, we're talking about CHPs, we're talking about midwives and nurses who've just recently joined this.
Yes.
Okay? So years ago, you have a CBA. Everybody agrees, we sign on the dotted line, everybody goes back to work, right?
Yes.
Now, when the stipulations of this CBA are abrogated, then people give a strike notice according to labor laws. Somebody decides, okay, if you're not going to adhere to this, let's go on strike. We go on strike. We have this debilitating issue for a couple of days. And then something happens. A boardroom is open, people sit in that room. I'm very curious. What is said in that room that then people now come and they call all of us to come for the presser and they say, we have a deal? What is said in that room for people to then go back to work, only for us 6 months later to be back where we were? What is negotiated? Who agrees to something? What happens there?
Of course, the agreement is always reached between the two parties.
Saying what?
On various issues.
No, you have a CBA.
But that's what I'm saying. The CBS contains different issues, a myriad of issues, yeah? Right? And I've just tried to extrapolate on the issues. If, for example, we agree, for example, on issue of allowance, and then you don't pay us.
Yes.
For example, we have agreed that from this January, or from beginning, we actually in August.
Yes.
We actually, for example, public health officers will be entitled to allowance of this amount of money.
Yeah.
Then we go for 3 months, you're not paying. It means you have negated on the CBA. Then it means that then we must be able to go back and start asking, how do we have now these things realized? And by the way, strike is always a last resort. We've always been engaging. You know, we also don't like going for a strike. For example, before we go for a strike, and that's why we say, with that window of trying to talk to the employer, give them a notice of inviting them for a discussion. But when the employer is actually adamant, he doesn't want to come on the table, that's where the problems comes in.
Brown, I mean, what is it a conversation about? Come in and have a cup of tea? That's what I'm asking. What happens in that negotiation? You've just said, from January to August, an allowance that is owed is unpaid.
Yes.
What makes sense to me is that when you're in that negotiation room, we are coming out when the allowances have been paid. So what is it that's said for people to agree? They've not paid from January to August. So the assumption is that in that room, when you're saying we will not go on strike or we've called it off, is that somebody signed a check.
Somebody signed on the dotted line.
Or no, or what? Because what is it that somebody is going to say that will then say, okay, fine, we're no longer on strike, when the thing that took you to strike has not been resolved?
You see, Brown, you always develop what you call a return to work formula. Right? Formula, so that's the consensus from this whole negotiations.
Yes.
And time and again, that is violated. Could be with you, the healthcare professionals or the teachers, various, categories.
Category of people.
This happens with our outgoing regime. Now, the question is, healthcare is a public service. Just like security.
Yes.
Just like the judges. We don't hear much. Police do not strike saying that, our CBA, they've never demanded a CBA, right?
They are members of the discipline.
Yes. So, healthcare being a public service, in your opinion, as you go for the county, governors, as you go for the CS Health, what is the CS of public service saying? Because this is a long-standing matter that has not been resolved. And from what you're saying, you're not very optimistic about the matter. Being a public service, being a public good, healthcare is one of the things we can, just like security, one of the things we should not afford to compromise on.
Yes. I'll say this, and that, by the way, that's the reason why you're saying in this election, and we are very particular in this election, while we are voting for our leaders, we're actually asking the IEBC to provide another ballot paper box. We want to vote for Health Service Commission. We want health to be reverted back.
But that is not practical. But that is, let's be realistic. Because no. For as long as the Constitution is alive, what we have is what we work with. Today's provision provides that you have a CS Health. And you have so many other CSs and PAs. So we cannot have a seventh ballot. That is not going to happen. So that even your union members, you do not give them false hope. There will not be a seventh ballot on the 10th of August next year. And
then prepare for perennial strikes, because let me tell you, because for free, there's something we need to live to. I like Niccolò Machiavelli. Niccolò Machiavelli is one of the principles he said was, he has 5 principles that he wrote in his book about the prince, and he says about one principle that I like most about Niccolò is about realism over idealism. That you must be very real to the situations. You must come to the ground and understand that things are not working. If things are not working, for example, if health was devolved by our constitution, it's not working. And it's us who actually, when the alligator comes from the water and tells you that,
Now that we are outside, what guarantees are there that you are going to work only if your terms have been met, that the monies that have not been paid are paid, that the contracts that have not been issued are issued? Or is it another case of we signed on a dotted line with we hope to God that it will be done?
First of all, RS and CBS are creation of the law. That's the Labor Relations Act. When a union is registered in this country, the first thing for that union is supposed to do, first of all, is to sign a recognition agreement with the employer. That is to say, Section 54. That is to say that the employer takes a full responsibility of that union, because you have actually, there's a certain percentage, like 50 plus 1. You have a simple majority of the employees, the workers you actually do what? Represent. After you sign an RA, then comes a CBA. Now, that's a collective bargaining agreement, actually highlighting issues, because each and every union represents unique workers. For example, as public health union, we represent public health officers and technicians in this country. These officers are actually the people who do preventive work. And that's what I'm saying. Even in our strike, right now, we're actually experiencing very weak disease surveillance systems. If you look at the people who are supposed to be tracking down diseases, detecting diseases, responding to emergencies, outbreaks, they're actually on strike. Looking at our border points are actually very porous right now. We're talking about national health security here. The PHOs were actually designated to be at the border points to be able to screen travelers, be able to inspect food, be able to do sampling of water, food and water analysis, are not doing that. Our national public health food labs are actually empty right now because these workers are actually on strike. What are we saying? We're actually projecting a nation that can maybe actually fall sick anytime from now. God forbid if we have an outbreak right now, like for example of cholera or Ebola comes back or whatever, Marburg, whichever, or COVID-19, will be in shit right now. So what we are saying is that the CBS needs to be honored unless we change the Labor Relations Act, because we actually govern by the law. Unions are a creation of the government. By the way, if you go to the developed countries, unions are supposed to be funded by governments. Because they are creation of the government. They are supposed to be working. We represent workers who work for government. They don't work for ourselves.
Yes.
Brown. Yes. The CBA that you had is something that you delivered to court.
Yes. Deposited in court,
yes, right?
Yes.
That means it's an order of the court for implementation, right?
Yes. Yeah.
That has not been honored.
Are we also saying courts are also failing us?
That has not been honored. So then my question is, how do you get back to having a conversation and signing a new CBA with a party that has already dishonored a court order on the implementation?
You know why I'm liking your thinking is because also the employer now also knows that if like a court order, if you're not honored, then you're also in contempt of court. Because the reason why we deposit a CBA with a court is because for the simple reasons, to be able to track it and ensure that it's actually honored, because it's the award between two people. And sometimes because of the trust issues, let me tell you, the reason why sometimes this is like a marriage. When you're actually marrying, you have to have faith in each other.
It's a toxic one.
You have to have faith, you have to trust each other. If one partner goes outside and actually does very fun things, then you now talk of divorce. Actually, that's why we are talking about now, a divorce in this case. So when we actually have agreed with the CBA, and the CBA is actually one partner negates on its bid, therefore it means that the whole thing is actually not happening.
I'm trying to trace, Brown,
yes,
where a possible solution could lie. Because we can talk about the problem until the
cows
come.
Okay.
Yeah.
Cows come home. We've had a very milky conversation this morning.
Sorry.
Yes.
We must try to look into where solutions can come from. From what I'm hearing you say, you seem to have more of a problem with the law, regulation, constitution than the people who are in office. Why else, in my opinion, according to the formation of our regulations, our laws, the constitution, it is perfect. The problem is the people who are in office are the ones who are failing to execute their mandate.
But it's us who put them in those.
I do agree. Yeah. So I'm trying to understand that is your position that if we change the constitution by reverting the public health officers to national government,
yes,
we are going to have a solution? Or is your position that people who are mandated today as per our current constitution are the ones who are failing to execute their mandate?
And that's why we said we need to have a health service commission. Just like the teacher service.
No, before forming any new organ.
I'm coming to your point about our good governors who are actually in charge of our county bosses. You know, we have had a mix of achievements in respective different counties. You get, like, for example, county like, for example, Murang'a, or a county like Nairobi, for example, or whichever county, you find it in health-wise is actually doing better. Other counties are not doing anything in regard to health. That one tells you that how would we prioritize what we do? Most of our county bosses are busy chasing deals and cutting deals and contracts and other things and corruption, as opposed to addressing the real issues. You know, sometimes you also need to be, and that's why sometimes I like Genesis for one fact. Kenyans, we need to reach at a level that we need to come up and say no to this old nonsense about health. Because, for example, most Kenyans are dying at the casualties. Casualties at the county referral are the casualties. But how many they are dying? They are dying because we have a problem with the health workforce. Our healthcare workers are overwhelmed. We have very few nurses, very few clinicians, and very few doctors. And the population continues to appreciate. We know, we're talking about disease, dynamics in regard to health. We're talking about disease burden and also population. So the dynamics keep changing. But we don't change with the dynamics. The norms are still down. The county governors, since the Constitution 2010, since the promulgation of the new Constitution, we seem not to have agreed how many workers, like healthcare workers, we need to employ at our respective counties. If you ask them, they will tell you we have not employed. If they have employed, actually, it's actually very few.
Brown, are we having...
So the problem is the county bosses.
Because for a very long time, this discussion has only been held with the ministry.
Yes.
But there's a question that Joe asked. There is also the Public Service Commission, right? And I even dare say that we equally have the Ministry of Treasury, where money comes from. It has to be a conversation between Council of Governors, because health is devolved, the ministry, who is the custodian of the policy. There has to be a conversation on public service, Public Service Ministry, as well as the Treasury. If these four people are not in that room, then who exactly are you talking to?
Who is supposed to whip them to say together? It's not the worker.
You could as well demand.
It's not the worker.
It could be a demand that you have as well.
I mean,
who is supposed to?
I mean,
when you have
my considered opinion, is the president.
Okay. So he's the one who has failed.
So he's the one who's
called the House to order.
The president has all the rights, the legal rights, because actually is the unifying factor to be able to, like if it were not for the president, even this issue about monies about the UHC will not be there. Actually, it took the summit of the president to be able to ask the treasury to allocate.
So if the president calls the House to order tomorrow, the strike would be off.
Will be off.
If the president took charge, as he should, as the unifying...
took charge, and I even don't know whether our president watches the television. Sometimes I'm a Kenyan and sometimes I feel amazed. You are seeing people dying, and people are busy politicking. We are busy arresting people. When the really issues like health, there's a paralysis in the health sector. Where should we be able to put our name? So what I'm saying is this: the president and also our leaders need to be held accountable. Okay. And if the president took a whip, I can tell you for free, we'll have all this nonsense
come to an end. So maybe we don't need to change the constitution. We need to change the president and his people. But finally, you spoke about national government and its performance. There are about 6 institutions, 5 or 6 institutions that are still under the national government. And they're even awarded, budgetary allocations are done directly to them. In your opinion, how would you rate that performance, 0 to 9, of those institutions that are being managed by the national government?
Like which one, for example?
Kenyatta, all these referral hospitals. You can take Kenyatta, you can take Eldoret. Those are the ones that are under national government.
The indicators to performance. Indicators, and it actually depends on what.
Just overall, in your opinion, as a public health officer, where you sit down and say this institution is actually executing its mandate in terms of healthcare as it should.
On the counties, I'll give them 4 out of 10.
No, the national ones.
The national ones, I don't work at the national.
But these are things you should know.
It's
Your
good.
people.
What I'm saying is that, when there's a crisis here, there's a crisis all over.
Right.
You cannot be able, we don't have, different, because when health is not working, it's not working all over. Because the same workers work at the national. I actually work, the same guys work, but it's better than national.
Brown, we have to address this, and our time is running out.
Yeah.
What is it going to take to make sure that Kenyans who are suffering the pressure of this between health workers and government to be released of that pressure in hospitals across the country? What is it going to take for services to resume and then actually have them operate at the optimal?
Yeah. I want to urge respectfully the warring factions, that is the Council of Governors and the Minister of Health, to put down their ego a bit and listen to us. Invite us for a table, for a discussion on a table. Like I keep saying that if the continued push and pull is actually exposing Kenyans to more of harm. We are seeing more people going to private facilities being overcharged. We are seeing pregnant mothers not being able to deliver safely. We are seeing people with terminal illnesses, actually, like the way you said about cancer and diabetes with the sickle cell, actually suffering. So I want to respectfully request that, and also request the president to take charge and take control of the health sector. Let the two warring factions, we need to sit down. We don't need to have a strike to have an RA sign. Actually, a recognition agreement is non-monetary. That's the simplest document you can actually be able to sign, because we have actually 4 unions without an RA. And what we're actually saying, if the Council of Governors sat down with the ministry and actually had that committee, the centralized committee, we can actually have this thing actually done and dusted as early as today. But the continued push and the trading games is not actually helping anybody. It's actually subjecting Kenyans to much more of healthcare suffering than the way it's supposed to be done.
Indeed.
So for the best of this country and also for posterity, let's ensure that we solve this in once and for all. We are willing as unions to come together. And we don't want to go on a strike. We want to solve this issue once and for all. And everybody should actually do their bit.
Okay.
Brown Ashira Olaly is the National Secretary General and CEO of the Kenya Environmental Health and Public Health Practitioners Union, of course, with KUKO and the Nurses Union and the Midwives Union, all in this strike. Saying, what, we need to get this thing sorted out. And the things that we agreed on sorted out once and for all. For a health system that works. Indeed. Thank you for being here this morning.
This is the